Hi viewers, welcome to another edition of Marriage Clinic Live. How are you today? Happy Sunday. Hope we are having a restful weekend, and congratulations for making it to the end of the month of May. It's usually a privilege to be alive and to be well. I remain your host, Morala Han Oputi. Thank you so much to everyone who joined us during our second year anniversary. We had a very good time during the anniversary, and I hope that we will keep going back to learn from those videos. You can always find it on our YouTube channel, Marriage Clinic TV. So today, in the mood of celebration for our Children's Day, like I said, that we will be having a special guest today in the house, and she'll be talking to us about quite a number of things. It's actually going to be a Q&A section. She'll be talking to us on different areas ranging from maternal health to childcare and children's well-being, and even our own well-being as a mother or as parents. So we'll be looking at all of these things today. Please do join us. Share this as much as we can. It's a privilege to have her. She is the head of nurses at Reddington Hospital at Ikeja, and she's very well experienced. She is a wife, a mother, and a grandmother. And she's also into marriage counseling. It's a privilege to have in the house today Mrs. Fidelia Inogbo. We welcome you, ma. Welcome, welcome, welcome to Marriage Clinic Live.
Good evening, everybody.
Good evening, ma.
It's good to be with you all.
Yeah.
In this session, and I hope by the end of the session you'll be able to take one or two things away, and you'll be able to have acquired some form of knowledge or the other. True. We're not all perfect people, but we do know that with experience we can always give one or two I would say advice and counseling to people who are still coming up and who are still trying to feel what it is like to be in the life of a family, a married person, a mother, a wife, and a helpmate, as it were. So you're all welcome.
Thank you, ma'am. Thank you for accepting our invitation. So we would like to go straight to the question and answer section. So the first one was sent by a woman. She said she's a young wife. She has been trying to conceive for some years, I think about 3 years now, to no avail. She said they've been to the hospital. They are medically certified okay, yet she's finding it difficult to conceive. So she's asking, is there something she needs to do differently, or what she's not doing well?
Okay, thank you for that question. I heard you rightly that they are both medically certified.
Okay.
To be okay. So I will just go straight to the point. I'll just advise her to relax, because sometimes the systems of the body, they work together. There's no system that can work effectively without the other system of the body. So, and we have the nervous system, the central nervous system, we have the digestive system, we have the cardiac system. In short, all the system, metabolic system, they all work hand in hand. And when a woman has tried for several years like that and has not conceived, the tendency is there for her to worry. She has the right to worry. And as she worries, little will she know that she's affecting some other parts of her body with her worrying. So I'll first of all ask her to relax, take a break from seeing anybody. Trying to seek for help to conceive. She should just pray about it, talk to God about it, change her lifestyle, and then eat well. Eat food that contains antioxidants like folate, and she will be able to, her system will be able to come back to normal without her knowing it, because whether you like it or not, her system had been affected by all those tribulations of going up and down and worrying and trying to seek solution to her problem. So she needs to change her lifestyle. Eat well. If she was missing breakfast before, she make it a habit of taking her breakfast, because that will help the brain for itself. Every message starts from the brain. Every message from the system starts from the brain. So she needs to learn not to miss her breakfast. She will try to avoid fats that are not digestible, trans fats, so that at all times she's not accumulating any extra anywhere in the part of the body that can clog up some parts of the body that will aid anything to make her immune system okay. Then she should be active. She should get, some form of activity, exercise in any form. Walking around your neighborhood, in your compound can help you. You don't have to sit down, moan and groan every time because of your situation. Just be active, take time to relax, take time off work if you have to have a break. Have a healthy weight. Always try to weigh yourself. Make sure that even if you're not losing, because to lose weight is not easy, you shouldn't be seen to be adding. But if you are already above average weight, that's like what we call obese. Not obese in this excess obesity, but there's a body mass weight. So if you're already obese, you try to work on it to reduce, not to gain, so that you will have a healthy system. And then,
Okay.
of course, prayer can solve a lot of things. Prayer,
True.
yeah, it's
True,
good.
ma. Thank you so much for that. So the second one says, what causes miscarriage or and stillbirth in women? How can a couple prevent such occurrence from happening?
Okay, there are two different things: miscarriage and stillbirth. You can say that a miscarriage is one that happens before 20 weeks of pregnancy, and then while a stillbirth can be even up to 10 and it will not come out live. It can be above 20 weeks and you will have it as a stillbirth. So, miscarriages, there are many known and unknown causes of miscarriage. So, but for a woman who miscarriages or who gets a miscarriage frequently, she needs to check herself. But most importantly, you need to know that if you are taking any drug, if you are smoking, if you are taking any drug that is not prescribed to you to take by your doctor, you're likely to have a miscarriage. And then if you had had some and what we call endometrial issues, that's the lining of the uterus is the endometrium. If you have shed them too often, either from a previous miscarriage or what you can call a dilatation and curettage, what people layman call D&C. You can have the lining of your uterus not be able to harbor a baby or a fetus, as it were. So that can lead to miscarriage. There are some also hormone irregularities. By the time you start having, you've had one, you've had another one, of course, your doctors will check you. If you have a hormone imbalance, it will be corrected. There can also be improper implantation of an egg that is supposed to be fertilized to bring about pregnancy. It may not implant well due to what I have just earlier on said, like the lining of the uterus being shed off many times and then cannot, it's like something that can grip, but it's now not gripping. It can't hold. It's smooth, as it were. That's the only way I can explain it. It's smooth, and then you will have issues with that. Then also, nature on its own has a way of getting rid of such, pregnancies that will bring about problem, like a malformed child. You may not know that your child you're carrying is not forming well. So, but because you are not ignorant of it, nature has its own way of making it just come down, and that will come down like a miscarriage. And then we have what we call incompetent cervix. That's the neck of the womb. The cervix is the neck of the womb. When
Mm.
pregnancy takes place, the neck of the womb is supposed to close up so that yes, the neck of the womb is supposed to close up at certain point in time of pregnancy. But remain permanently open, and then the pregnancy will come down. And those are some of the causes of um, miscarriage. Then,
Mm.
if you now go and look at um, stillbirth, like I said, stillbirth occurs, after 20 weeks, and sometimes even up till term, and it will just happen. All of these things are also can be due to lifestyle problems. You may have been like a smoker. You may have used some illicit drugs in the past. You may have even used some, recreational drugs like, all those hard drugs or something. To some people who find it difficult to sleep, they keep taking all these sleeping tablets. You may be
Mm.
malnourished. You may have a malnourishment problem. You may
Mm.
have existing health problem like diabetes, hypertension, all of those things. If you are pregnant and you are not being looked after by your doctor properly, they can
Mm.
lead to stillbirth. At some they when it's time for the baby to either be born, or just before it is time for the baby to be born, you may just see that movement has ceased. And this is as a result of some of those underlying issues you may have
Mm.
had. And sometimes multiple pregnancy can lead to it. If you're carrying more than one, like twins or triplets, it can result into a stillbirth as well.
Mm.
Then there can be a placenta issue. The placenta is the connection between the baby and the mother. The baby feeds through the placenta, gets all the nutrients from the mom, from the circulatory system, from the placenta. And if there's a placenta problem, there can be a detachment of the
Mm.
placenta from the mom in utero, that's in the womb. And then this can cause a stillbirth, because it only means automatically the child is lacking oxygen.
Mm.
And that leads to death, of course,
Mm.
of the
Photos.
fetus. Yeah.
Okay.
Infection
So,
as well can cause that. If you have a severe urinary tract infection or any form of infection that is generalized, that is not taken care of, can lead to a stillbirth.
mm. But can infection lead to miscarriage?
Yes, of course. Infection can also lead to miscarriage if it is not, treated. That's why when a woman before 20 weeks, if you have any slight fever, if you have like a frequent urination, you
Mm.
need to see your doctor, because it only means there's something going on in the bladder. You shouldn't be seen to be
Mm.
urinating frequently, and sometimes you have pain with it. Low
Mm.
abdominal pain. It means that there's possibility of you having a urinary tract infection.
Mm.
It can cause miscarriage as well.
Mm. Okay, ma. So the other question says, the next question says, a woman is asking that after delivery, she started menstruating 2 months after delivery, but the mercy stopped. The mercy stopped coming again, and
Yeah.
it's not that she's pregnant. That why is that, and is it normal?
Well, periods may be irregular
Mm.
after delivery, but usually you are supposed to have a period of about 6 to 8 weeks of before you can start seeing a period again, and then before it can become irregular, and then with time it will become normal.
Normal.
If you are breastfeeding, it will assist you If you are doing breastfeeding, that's you are completely breastfeeding your baby, it will help you have a kind of a free period, time, a free menstrual flow time. Then if you are not breastfeeding, within 6 weeks or 8 weeks of delivery, your period should come back normally. And then it can be irregular, and of course it will now normalize. But I don't think there's anything wrong with that. If you are doing both, that's breastfeeding and artificial feeding, you may not have it completely, you know, free, but eventually it should normalize. But if it now does not normalize, you should see your doctor, because it only means that maybe during delivery you still had some particles of your placenta inside of you. It's possible, and then they will now need to like evacuate you, clear the area just to make sure that everything is fine.
Okay. Thank you, ma, for that. So there's another question that says, is it good for a woman to be having sexual intercourse while she's menstruating? Because her husband always wants her to still have intercourse even while she's menstruating. So she's asking, is this okay, or are there health implications to it?
There's nothing wrong with it, if you ask me. It's a matter of choice. It can only be messy, but there's nothing wrong with it. If you are worried about the messiness of it, then you may not use a plain, when a plain colored bed sheets for your bed. You may have something darker lay on it, just to, like, you know what I mean, yeah, just to make it look a bit as if you are conscious of the fact that blood is flowing. But it's really a matter of choice. The only thing that can happen in terms of medically is, you can say, maybe infection if either party is not clean per se. But otherwise, you can only transfer infection from one party to the other.
The other.
But there's nothing wrong with it. It's just a choice thing.
Okay. So so you talked about the issue of if each party is clean, but we know that the way the society is now and the way some couples run their marriages, we usually find some of these marriages being characterized by infidelity. We have
Yeah,
cases of with the man cheating on the woman, having
yeah.
multiple sexual partners. We have also cases of the woman cheating on the man, no faithfulness in the marriage. So, in terms of STDs or even HIV, someone is asking if she's aware or he is aware that my partner, is the cheating type that sleeps around, that is it advisable for her to still continue to have sexual intercourse with that kind of a partner?
You mean during period or any time?
Anytime, anytime,
Oh,
even.
for as long as you're married, you cannot deprive your partner from, because sex life is part of marriage. You cannot deprive the person of that aspect. The only thing is that if you know that your partner is not faithful, it's something you have to talk about. Both of you can sit down and talk about it. You have to detail yourself about the implication of being unfaithful in this time and age. And then you have to now ask yourself question: do you want us to now start having problems with treating STIs and treating, or living with HIV or something like that? It's something you have to, because sometimes people do things without knowing, looking at the bigger picture. They just see it of now, okay, I just want to have fun. You go and have fun, and then you have fun and you bring problem home, and nobody wants to receive any problem from any unfaithful partner. So it's just something you need to talk to yourselves about. And then you just can't deprive yourself of sex, because sex is part of marriage.
Okay,
It's
so
what brings you together intimately. You have to be very intimate with
okay.
each other.
Okay, man. Thank you for that, man. So we have this case of a woman who said, "Oh, ma'am, I'm aware this man is the promiscuous type, is never faithful, he's been having multiple sexual partner, and that through him she has contacted all kinds of STDs, that the only one left that she's yet
It's
to be
HIV.
diagnosed to contact is HIV. So that kind of a woman, what advice should we give her? Should she still continue to have sex or sexual contact with that kind of a partner?
They both need to be cancelled because now it's beyond two of them talking to each other. They need some form of counseling from a neutral
Person.
person, yeah, or a professional, as the case may be, so that either party will understand, you know, the implication of what he or she is doing, and then we'll know the effect, the toll it will have in the home. Because if invariably the home is not going to be stable, it's not going to be a happy environment for themselves and even for the
Children.
children coming up in the home. So they need to really address the issue on at that angle. That's by seeing, you know, counselors or seeing a psychologist, as depending on how far the matter had gone in terms of reinfection and reinfection and reinfection. Because if you keep reinfecting yourself, actually you need a psychologist. It's just beyond ordinary counseling.
Okay, ma. So this question says, how should parents care for their children, especially for a girl child and a boy child? Are we supposed to care for them? Are we supposed to care for them differently, or is there a different way to care for a boy child compared to a girl child?
I would say no, there's no different way because for one, girls they mature, they get to their developmental milestone faster than the boys. So we tend to see that girls mature earlier. But having said that, does not mean that they should have preferential treatment because whatever the girl suffers or experiences as she grows up is also what the boy also experience. We've seen cases of even boy abuse as it is, as a girl child is being abused,
Yes.
a boy child as well is being abused. So there's no special preferential treatment. Anything you need to do for them, you raise them the same way. If they need to, if they get to the stage of washing up plates in the kitchen, even if it's their own plates, they do it in turns. They take it in turns. You make a timetable for them. Let them know that it's not, because the minute they understand that they all are part of the family, they contribute to the, family growth and the outlook of the family, they will begin to appreciate, being in a family, giving out love, showing love, sharing. You begin to appreciate all those words, how to share, how to,
Help.
identify people who are less privileged than them. They'll begin to appreciate it. Because if you now say, oh, because it's a girl, she should always stay in the kitchen. The boy is special. Let the boy be in the sitting room watching television. You are not doing him any good. There's no preferential treatment. They should
True.
both be raised, because these days, is there anything that a man does now in terms of profession that a woman cannot do? We've had women pilots, we've had civil engineer women. Let me don't talk about the other engineering. Civil engineer, yeah, we have them as females.
Yeah.
Even the IT of today, we have women in it. So there is nothing special. They should both be seen as even though they are naturally different individuals, but that does not, their differences doesn't have anything to do with their upbringing. The differences, is in their physique, their nature, you know how a girl child comports herself better than a boy child. Those are just the things you can see, the differences, and they are, of course, what their body carries. But aside that, there's nothing. They should be raised equally the same way.
Okay, but mentally, do they reason the same way, or they reason
Okay,
differently?
okay.
Or how do they process information?
Yeah, the boy child has a higher level of a hormone that we call testosterone and a lower level of serotonin. So, and this makes them easily aggressive and stressed up, unlike the female counterpart. The female counterpart is always like, that's why they're always the lady. When you use the word lady, you're already expecting to see, oh, a calm person
Okay.
seated well in a corner, listening quietly, peacefully to instructions and taking in whatever is being said.
Mm,
But the boys are different, and it's just the nature, it's just the hormones in them.
mm,
But nurturing them should be equal. There should not be any difference in the way you nurture them in the home environment.
okay. Okay, man. So there's this question that says, at what age should parents start educating their children about sex? At what age should we start giving them sex education?
Yeah, if you ask me, I will say as early as possible,
Mm,
but at different levels. As early as 3 years, you can start talking to your children about sex. That's when what I mean at this level is that you begin to tell them the parts of the body that deals with you that gives you your body, that stimulates your body. For the girls, like their breasts. You tell them you try to use the right words for them. In our time, you hear things like bomb bomb
PP.
shoshota, and things like that. But these days, the experts have said that we should use the right
The
words for them,
right word.
so that they begin to know, and you let them know that at that stage, no other person can touch them except their mom. When their mom is bathing them, giving them, a wash, they should not let people touch that part. That part is a sensitive part that is useful to them in future. Then as they grow, once they pass that stage again,
Mm,
the tune changes, the
mm,
words changes, whatever you're going to tell them. Then when
mm,
they become teenagers, you don't rely only on what the school teaches them. You also begin to tell them things like the girls now. You begin to talk about menses. For
yes.
the boys, you begin to let them know that they cannot just go near anybody, and that's a female partner to just be doing as if they don't understand what they are doing. You
Mm,
just begin to let them know different levels, different teachings,
mm,
different terminologies is
mm,
what you will use, but you
mm,
can always get to it
mm,
so that they get to know.
mm. Okay, ma. Thank you for that. Is there any impact on frequent unrest, fight, quarrel between parents on the child's upbringing and their psychological development?
Of course, the a home that is not at peace, or that is always having an unrest situation,
Mm,
can destabilize the children.
true.
It can affect them socially, it can affect them academically. Socially, in the sense that when they go out, all they know is aggression, all they know is beating or whatever it is they've seen.
Fight.
Maybe a hair fight, whatever they saw, because it's what they see in the parents that they are going to go and display outside.
True.
So we need to be careful. So it will affect them. There's no doubt about that. The turnout of children being aggressive and being delinquent is just as a result of what is happening in their home. So parents should try to. There can be issues. There can be somebody can hurt you. Your partner can hurt you to the extent that you shout about it, you make noise. But as soon as the children see you make up, oh, they are happier than when they actually saw the fight begin. Do you
Mm,
understand? So they need to see the fact that Oh, you fight. Yes, you can fight, but you make up and life move on. And but you shouldn't let it be a repeated action, because if you do that repeatedly before them, they will go out there. And
Mm.
when it's school time, you see them, they don't want to go to school. There are
Mm-hmm.
issues. They are like, it will be affecting them psychologically. They will think what they are going to face in school, they do not know. It will definitely disrupt their development. It will.
Mm.
Any which way you look at it, we are
Mm.
responsible for the outcome of our children. Parents are
Mm.
responsible to take all the blame. That is the truth. So we are their mirror. So we have to be careful what we do before them.
Mm.
If you
Okay, ma.
must shout, okay. If you must
Mm.
shout, try and do it while both of you are in your closet so that they
Mm.
don't get to see.
Mm. So, ma, based on what you have just said, some parents may argue that, oh, no, no, you can't say parents are completely responsible for the outcome of their children, that they've trained their own children. It's left for the children to hear what they have been told or to put the training to use. So, for example, you have some children from good parents, but they turn out to be maybe drug addicts, battling with one form of addiction or the other. What could be responsible for that? Because I also believe that the parents are responsible for the outcome of their children, but some people don't believe in that. They believe that, oh, everything is, subject to the grace of God, which we believe. We believed in the place of grace, but they still believe that, oh, you can only do your bit, but that what they end up becoming or whatever they end up turning out to become cannot be blamed on the parent. What can you say to that, man?
Yes, what I can say, I still maintain that we are the responsible,
Hmm.
because if you are doing your own, let's say you think you are doing what you're supposed to do in the house, and your children are out there keeping friends, you don't even know where their friends live. You don't even take your children on, to say, okay, let me drop you off your friend's house, meet the family, know them, have a chat, leave
Mm,
them to play, go home,
mm,
come back, pick the child. Try to intimate yourself with their own environment. You may not know everything, but you have to be seen to make efforts to know where your children go to and
mm,
what they do when they go there.
mm,
So I still have that feeling that yes, grace of God is there, no doubt.
mm,
But grace comes when effort is seen. We can't deceive God. We
mm,
really cannot deceive God. Sometimes we tend to live a lie life, but
mm,
it's all up to us. We all look up to God for everything.
mm.
It's not God is not a magician. I'm
True.
sure we all know that. So we heaven, and the literal saying, heaven helps those who help themselves, is also there.
Mm,
But I still believe that we still need to be seen to make effort to do what we are supposed to do in terms of nurturing these children
mm,
and seeing them through life, just to be sure that you've done your own bit.
mm. Okay, ma, thank you so much for that. So this question is on family planning. Maybe you want to tell us, ma, on the natural ways to it, to family planning, because some young couples, especially the women, have complained that, oh, there are a lot of side effects to it. They don't like it. They don't want to do it. It makes them add weight. It makes them bleed uncontrollably. Some husband will say, no, no, I don't want family planning yet. He doesn't have the resources to support a large family, but they want to keep having children. So, what natural ways can you advise that couples can adopt for family planning?
Family planning is good. It affords one opportunity of spacing your children and controlling the number of children you want to have. It's important that we understand our body system. Natural family planning is all to do with you knowing yourself, knowing your body system, and then being able to know when you're fertile and when you're not fertile. And everything also in life is about discipline. When we're talking about a couple, yes, you're married, you have the license to do, you know, have sex as much as you can have it. But you also know that the results of sex activity, sexual activity, is, bringing up children, which is also good. But you can't be bringing up children every 9 months or every 10 months or
Yes,
every year.
every
You would like
year.
to space. Yes, you would like to space. And then so natural family planning involves you knowing yourself. You have to learn to, from the first, because for a woman now, your cycle is either 28 days or between 28 and 35 days. Let me just put it that way. That's, you can say, your regular cycle. And then we all know that ovulation period is the time a woman is most fertile. And your menstrual period is from the first day of one menstrual flow to the beginning of another menstrual flow. And then we have, you have to have the two parties are involved in family planning. It's not just for the woman. The husband and the wife are supposed to have what we call a chart. The man will have the chart will be placed somewhere both of you can see it. You take your body temperature every morning. You also notice some body vaginal discharges, so the one when it is egg white discharge, when it is slippery, when it is sticky, when it's like pap white, you know. So when you study all these things, actually it's called a Billings method. It's a school of its own. To learn about natural family planning, it takes about 12 weeks course for you to do it and then learn it and know it, because it entails a lot. You need to be writing down things. You need to be chatting down things. You do it for 2 months, you'll understand your body system. And then the couple will now know when they are supposed to, play around, and so in order not to have a resultant, pregnancy.
Pregnancy.
Yes. So that you still live your life normally. You still feel each other, touch each other, but you know when not to go, further, so that you don't get pregnant. Because family planning really is about trying to check when you want pregnancy to happen and when you don't want it to happen. And then and be able to say, okay, I want 4 children, I want 3 children, I want 2 children. And even if I want four, I want them to have like 2 years in between them, or 1.5 years in between them. So it's not a question about somebody loving to have many children. Yes, children are good. They are gifts from God. And you can't say you don't want to get a gift from God. But also, God made the natural family planning in place for you to know that you can't just be procreating every now and then if you cannot cope with
True.
bringing them up, because it's not enough to bring children to the world without looking after them.
Mm.
You are not doing them any good.
True.
So I hope I have answered it.
Okay, so it's just that one method of chatting, um,
Yes.
what they see, knowing their body.
Knowing your length of cycle, knowing your body, knowing your ovulation period, because your ovulation period, some signs are there for you to know.
Oh,
When you see the egg white discharge, it will
mm,
just be slippery, it will not be sticky,
mm.
you know. Then
Okay.
when it's like,
Yeah, sorry about that. That must be the network. We'll join you shortly. Let's just give her some time to reconnect. Um, I believe she'll be back shortly. So I hope we are learning a lot from that. Please don't forget to share this video, listen to it, share it with your friend. There is always something to learn from it. And if you are yet to subscribe to our YouTube channel, please go and do so, because we promise to bring you more insightful educational videos and topic that you will be learning a lot from. Another thing is, try to follow us on all our other social media platform. Wow, we've lost her. I can't even see her anymore. Okay, so let's just bring this to a close. I hope that with the little she has said, we have learned a lot. I think we have just one more question to go, but we can always handle that on the platform. So thank you so much for joining us today. Invite your friends and family to join us on our Marriage Clinic online community. The topics are usually hot, real life issues, and we try as much as possible to do justice to them. So I remain your host, Marlaya and Oputi. Thank you so much for joining us. Do have a blessed week till we meet again. I say bye.